We've all had coughs and colds and have either treated ourselves with conventional over-the-counter medications or with the help of the family doctor found our way to better health. But what do you do when that persistent cough just doesn't go away? It could be signs of a serious condition called bronchitis or lead to a more serious condition called pneumonia. Let's take a look at both of these conditions, how to treat them, and even better, how to prevent them. Bronchitis is an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. Bronchitis may be either acute or chronic. Bronchitis occurs when airways become narrowed when they get tight, swollen, and filled with mucus. This is generally due to an infection of some kind or could be due to a host of environmental factors.
Chronic bronchitis is when somebody has established lung disease and bronchial inflammation. They have to live with that, and they may have some symptoms, and with medication those symptoms may be improved and their quality of life improved. But patients can get acute bronchitis, so an acute exacerbation of their lung disease that is typified by what we call the three cardinal symptoms, which is they have increased cough and phlegm production, and they may have shortness of breath. And those are things that tip the physician off that these individuals are having an exacerbation of their chronic bronchitis.
For either acute bronchitis or chronic bronchitis, signs and symptoms may include cough, production of mucus or sputum, shortness of breath made worse by mild exertion, wheezing, fatigue, slight fever and chills, chest discomfort. If you have acute bronchitis, you might have a nagging cough that lasts for several weeks after the bronchitis resolves. However, bronchitis symptoms can be deceptive since you don't always produce sputum when you have bronchitis. Besides the basic treatments of rest, liquids, and over-the-counter cough medications, these suggestions can help make you more comfortable, speed recovery, and prevent complications of acute bronchitis and help control the symptoms of chronic bronchitis. Avoid irritants like smoke, polluted air, or paint and household cleaners with strong fumes. Use a humidifier. Warm, moist air helps relieve coughs and loosens mucus in your airways. Acetaminophen and ibuprofen may help relieve pain and lower a high fever. Wear a cold air face mask if cold air aggravates your cough. Slow your breathing. Pursed lip breathing may help you feel better. Take a deep breath, then slowly breathe out through your mouth while pursing your lips. This technique increases the air pressure in your airways. To reduce your risk of catching a viral infection, wash your hands frequently and get in the habit of using hand sanitizers. Avoid crowds during flu season and practice social distancing of 4 to 5 feet. The less you're exposed to the viruses that lead to bronchitis, the lower your risk of getting it. Many cases of acute bronchitis result from influenza, a virus. Getting a yearly flu vaccine can help protect you from getting the flu, which in turn may reduce your risk of bronchitis. Pneumonia is an infection of one or both lungs, which is usually caused by bacteria, viruses, or fungal material. Currently, over 3 million people develop pneumonia each year in the United States. Over 500,000 of these people are admitted to a hospital for treatment. Although most of these people recover, pneumonia is the 6th leading cause of death in the United States. The most common symptoms of pneumonia are cough, fever, shaking chills, shortness of breath. Other symptoms include sharp or stabbing chest pain that gets worse when you breathe deeply or cough, night sweats or unexplained weight loss, headache, excessive sweating and clammy skin, loss of appetite, low energy and fatigue, confusion, especially in older people.
There are different degrees of severity, and some patients you may be able to manage in the outpatient setting. Other patients can have a more severe exacerbation, especially if they have more advanced lung disease, and they may need admission to the hospital. We may even be giving them intravenous antibiotics and other therapies to stabilize them.
If you are not sure whether or not you have pneumonia, the best and safest thing to do is see your doctor. They will evaluate your condition and probably run standard tests that will help in your diagnosis. They may hear crackles when listening to your chest with a stethoscope. Other abnormal breathing sounds may also be heard through the stethoscope via percussion, tapping on your chest wall. Your doctor will likely order a chest X-ray if pneumonia is suspected. There are a number of steps you can take to help prevent getting pneumonia. Many are similar to those of bronchitis. Stop smoking. Avoid contact with people who have respiratory tract infections, such as colds and flu. Wash your hands often. Use warm soapy water and scrub your hands for 20 to 30 seconds. Alcohol-based hand cleansers should also be used when practical. Get vaccinated. The pneumococcal vaccine is safe, it works, and one shot lasts most people up to 10 years. The shot, which is covered by Medicare, can be a lifesaver. Pneumonia can be a serious and life-threatening infection. This is true especially in the elderly, children, and those who have other serious medical problems, such as COPD, heart disease, diabetes, and certain cancers. Being aware of the causes, symptoms, and how to prevent exposure will keep you on a healthy path. Don't hesitate to contact your doctor if your condition doesn't improve. In fact, pneumonia can usually be treated with oral antibiotics without the need for hospitalization.